Today, the Assembly Health Committee and the Assembly Accountability Administrative Review Committee will be exercising one of its key checks and balances in the state government, and that is legislative oversight over state programs and the responsible agencies. Over the past few months, we have learned about disturbing level of potentially fraudulent activity in the drug Medi-Cal program. And in July, the Department of Healthcare Services, or DHCS, announced that they had suspended 16 providers and referred them to the Department of Justice for fraud investigation. The tally of fraud investigations by the department continues to grow, and as of this week, I understand over 50 providers and 130 total sites have been suspended and referred to the Department of Justice. Also starting this in late July, the Center for Investigative Reporting and CNN have been reporting story after story about alleged fraud in the drug Medi-Cal program. The reports document a laundry list of alleged fraud, including fabrication of patient treatment documents, busing teenagers without drug problems from group homes to rehab clinics, paying clients amounts between $5 and $40 for showing up to fictitious counseling sessions, billing for patients who are incarcerated or dead, and billing for counseling numerous clients. One case, 179 clients on a day, when reporters who staked out the clinic documented fewer than 30 people entering or leaving the clinic. Questions have been raised regarding clinic and provider certification and the lack of follow-up by responsible agencies to concerns raised about fraudulent activity. Personally, as a physician who cares for children on Medi-Cal, I am outraged to learn that people are cheating taxpayers and vulnerable Californians who need Medi-Cal. I know firsthand how important Medi-Cal is to the health of many low-income Californians in our communities. So the state needs to ensure the integrity of the Medi-Cal program and maintain public confidence in this vital program. So at this hearing, we'll be asking DHCS how this problem developed and why it was allowed to persist. What were the red flags that alerted the department to this problem? And why is this problem only being addressed now? How did processes meant to control fraud in the system How did process meant to control fraud in the system fail? Drug Medi-Cal was previously administered by the Department of Alcohol and Drug Programs, or DADP, and 2 years ago was merged into DHCS. But even before that, DHCS was a single state agency responsible for the entire Medi-Cal program. I want to know why the department in this role did not take more significant actions to fight fraud in the program. The department will provide details today on its recent crackdown on drug Medi-Cal providers. And we do need to make sure that the department's immediate response is sufficient. But we also want to make sure there's a long-term plan to prevent this fraud from returning. We need to do more than just lance the abscess of fraud. We need to treat it so it doesn't return. So we'll be looking for reforms to the program that strengthen its integrity and accountability. After all, the mission of drug Medi-Cal is critical. Treating an individual with a substance abuse disorder not only helps that individual, that suffering individual, it also helps the community. Individuals with untreated addictions are more likely to have other medical problems, need additional social services, or commit crimes. Drug Medi-Cal serves a population that would otherwise lack access to treatment. We need to understand what went wrong in the oversight of the drug Medi-Cal program, and we need to fix the problem going forward so that people can get the treatment they needed.